Hi. I want to tell you about LASIK because we talk about it here, but there's a reason we talk about it all the time, because it's a very important thing. It's such a freedom thing. I mean, no more contacts, no more glasses, but so many people say, you know, who do I choose? Now, fortunately, many of you have believed in what I say. You've gone to Dr. John Dischel, you had great results, and I represent him for a reason because he knows what he's doing. And you know, not all procedures are created equally. Not all technology, not all doctors. So what we want to do is a little mini quiz here on what you should do when you talk to a surgeon. Because even with the same technology, the outcome can be different depending on the experience of the doctor. And then even a great doctor without technology is limited. So you have to have a combination. It's not all technology, it's not all doctor. Dr. John Dischler, thanks for being here.
Thank you.
We're going on 2 years together.
Yes.
And I got to tell you that I've had tremendous results since you started on the TV show. And of course, I've heard of you before the TV show. And I want to give you a quiz, okay?
Sure.
Because I want to make believe I'm a patient looking for a doctor. Doctor, how long have you been performing LASIK?
Over 15 years.
15 years?
Yeah.
Okay. Now, on a side note, I want to ask you, what do you consider to be the magic number? I'm just curious.
How long? How much experience people have? Probably 2 or 3 years. I mean, there's this questionnaire that was developed as to what to ask doctors, and everyone knows to ask, well, what does it cost? But what are the good questions to ask? And I think that's what, you know, we're going over here today. And the thought is that 2 or 3 years experience is probably minimal.
Yeah, with a number of procedures, though.
Right, right. Because you get, you know, that's how long it takes to be experienced in just about anything.
Right. And of course, you may say, well, what about those poor doctors that are just starting out? Well, they work alongside you. I mean, that's what it's all about.
Right. It's a training thing, yeah.
Well, what about how many LASIK procedures have you performed? Now, here's what's important. In the last 2 years, because if they've done them years ago with older technology, so you say, how many have you done, let's say, in the last 2 years? I'm asking you now.
Yeah, well, we've done over 2,000 patients in the last about 1,000 patients a year. That's and everybody's got 2 eyes, so about 2,000
procedures. Each eye is a procedure.
Right, per year.
Okay.
So,
and what do you like to see in a surgeon if you were going to pick one for yourself?
Well, I think that for someone to be experienced, they probably should have done at least 1,000 total procedures, and you know, they should be active, patients. And they should do, you know, they should have about 500 patients a year, something like that.
Okay. All right. Now, I like this question, and of course, a lot of this, I don't know if it depends on the patient or on the doctor, but we have many that come in here and say they see better than 20/20. Okay, 20/20 is great, right? So do you ask what percentage of your patients achieve 20/40 or better? Now, 20/40, is that better than 20/20?
No, that's worse than 20/20.
That's worse than 20/20.
Right, and that's the critical number for what it takes to pass a driver's test.
That's right.
So if you can see 20/40 or better, you can pass a driver's test without glasses.
But I would like 20/20 or better. I mean, is that unreasonable?
No, it's not. And, you know, almost everybody, you know, it's a strange thing in the medical world. You can't make guarantees. So we can't guarantee anything. What we have, and I didn't bring it with me, I was supposed to, is actually people can quote statistics, you know, oh, we get this, we get that. But here's what we have. We have a chart, and I didn't bring it.
Of actually that you've done.
And, well, what's more important is it's broken down into little categories so that you can take someone and say, okay, your prescription, you've got this much nearsightedness, this much astigmatism. You look where those come together, there's a little box, and you say,
what to
expect. Our experience in the past, people that start out where you are, 98% end up 20/20.
Good.
97% end up 20/20.
Okay, and it's based on actuaries.
And actuarial, for you, for your prescription, what your chances are of being, almost everybody ends up 20/40, 99.9%.
Yeah, right. That should be
so
easy.
That's an easy mark to reach. 20/20 is important, and, you know, overall, the answer is...
then we should ask how many are 20/20?
They say that at least 50, 70%, something like that, should come out 20/20.
What about you?
We're at like 98% 20/20
Oh, see, that's wonderful. So 98% of your patients come out 20/20, which is normal. And then what percentage comes out better? Because I've talked to them.
Right. Well, the thing that's really great is we use the Zeiss technology, and in their study, not just my experience, but in their study, which was, monitored by the FDA, 40% ended up better than 2020. And another laser we used, similar statistics. So
with you,
almost half, even on a national basis. And with us, it's actually a little better than that.
What percentage do you do better than 2020?
At least 50, 60%.
That's pretty cool.
Yeah.
But 90-something% on 2020.
Right.
So
and I want to ask you, that's what's so silly about these places that charge a premium for this 2020 guarantee. Isn't that silly? Because
yeah, I know. Because you should do it.
Yeah. Yes.
Now, what I wanted to say is, this is where a small flap is made with a laser, and this is where it's performed, not inside. So it's just really dotting the eye and reshaping it. So here's what I want to know. If this is a normal eye 2020, why can you get better than 2020? That's the part I don't understand.
It's because of the part in the back of the eye. It's
okay,
so here's the retina.
Let's look back here now.
That's like the film.
I'm going to get them back here.
The film in the camera.
Okay, right back here.
Right. And if the optics in the eye are perfect and it focuses, it's like, what's the resolution of your camera? You could actually potentially see much, much better than 2020.
Everyone can.
Everyone can. Most everyone. Do
there people naturally from birth sometimes have better than 2020?
Absolutely.
Okay.
Absolutely. 2020 is sort of what's designed as quote-unquote normal vision.
All right, so is the better than 2020 part the accuracy at getting this to focus, or does a lot have to do with our physiology as well?
Both.
Okay.
So if you can be corrected before the LASIK to better than 2020, if with glasses or contacts you can see better than 2020, then it's very possible with the LASIK that you can see better. But that's not what's really important. What's really important is 20 happy. Are the people able to see? Happy. Yeah, the numbers, those are clinical numbers that we use. But what's really important is, do people see well enough that they're happy? And usually if they're 20/20, they're happy.
Okay, have you ever denied or said to someone you're not a candidate?
That's probably the most important question, because I just asked my staff recently, what's the percentage of patients we turn down? And you know what it is?
What is it?
It's 20%. 1 out of 5. We turn down 1 out of 5 people that come into us. And that is that's the most important thing. If you see a doctor that says, I don't turn down anybody, I can do this, that's a big red flag, because people either have eye problems, unrealistic expectations, things that make them not good candidates. A lot of people that have trouble wearing contacts have eye problems that don't make them good candidates for LASIK. So most people are candidates, 4 out of 5.
Yeah.
Probably in the general population, it's much greater. Probably 9 out of 10 are candidates. Yeah. But in our experience...
because you get the more difficult ones. You get them, and you ask them, if you've been rejected, come and see me. And many of those you've been able to help.
Right.
But some you can't. So you ask for the higher risk. Now, by the way, I want to know quickly what kind of technology you offer. We talk about technology. What do you offer?
We have a certified surgery center that has the latest and greatest, and we have 4 lasers.
And it's your surgical center.
It's our surgical center. I'm the only one that touches the lasers. I'm the only one that does all the surgeries. And we have a variety of lasers that we take everyone on a tour, and we say, for your eyes, again, this is the laser that we use, and it's all the same cost. It doesn't matter whether it's LASIK, PRK, whatever. So we want to get everybody 20 happy. That's our goal.
I have a great idea. Put this in a card. Call up Dishler and have them make an appointment for one of your loved ones. Put in a card that you're going to give them the gift of sight. Wouldn't that be a cool gift? By the way, you'll get 15% off if you schedule by December 22nd. You don't have to have it done by the 22nd. Schedule by the 22nd, get 15% off. That's off the already guaranteed lowest price with the same correction, same technology, same everything. You can't touch that. That's $3,100, 15% off, and that's both eyes, and that includes everything you need. Dishler LASIK, 303-793-3000. 303-793-3000. Dishler.com. It's dish with an L-E-R. Dishler.com. Paul.